Welcome back. I would like to apologize because we start a little bit late, so we will be late for the coffee break. So I would like to apologize. I don't know if any one of you has watched Braveheart movie. Any one of you? Okay, where it has been, done, in which country? Well, it is not in Scotland, not in England. It has been conducted in Wicklow Highland in Dublin. And we have someone who came from Wicklow Highland from Dublin. And he is Mr. David Busang. And he is going to talk today about the painless path to a paperless hospital through technology and innovation. And we know that paperless hospital was a dream almost for all of us since 10 years ago. So I hope you can give us something about it. Welcome, Dave.
Assalamu alaikum. Thank you. It is a great privilege to speak to you today, and I will try not to delay you too much from your coffee. I would like to say that how important it is in life to learn how to measure. We know how to measure height and distance and speed, but the key question is always, how do we measure care? Now, we don't have to start from scratch in terms of how to assess measuring the quality of care, because there have been some very good studies done that give us dimensions of measuring care, measuring structures, processes, and outcomes. If we look a little bit more detailed, the structures are the settings in which the care is provided, the administration systems, the people. Processes is about how care has been provided, and then the outcomes is about the endpoints of care. But a key question always strikes us in our work: what is needed in order to measure? Now, it was mentioned in some of the presentations earlier on that the data will outlive the technology, and that is exactly the answer. In order to measure, you need structured data. You need information. Now, that leads itself to another question. How do you get the information? As you are going on a path to a digital healthcare economy, how are you going to capture information? There is always a large problem and challenge in gathering structured data from clinical paper documents. And that is the path that we went upon as we addressed the challenge of capturing information from paper as we go on the journey. So the introduction was very kind, and thank you. I'm from Ireland, and Ireland is a very small country with just 5 million population. So I'd like to bring you on a small journey across a bridge, and we will ask some questions and look at some answers together in terms of how we addressed one of the challenges of capturing structured data from paper. So across the path, I have a question. Do digital hospitals exist? Now, once again, that was touched upon in one of the presentations by the Deputy Minister earlier on. Well, there are very, very few totally paperless healthcare economies, and they're mostly in areas where a lot of money has been spent. So if we look at the data in terms of the HIMSS EMRAM, EMR adoption model, so electronic medical record adoption model, there are 3 statistics that I'd like to point out very quickly. Number one, in Q3 2012, 41% of hospitals have reached stage 3 of 7. In other words, they do have some clinical documentation which has become in the EMR, but they do not yet have decision support, closed-loop medication. Even if you look at stage 6, which is a very significant stage and it's difficult to hit, and it's a good success when you hit it, structured templates for physician documentation is a key target there. So a document is a structured document. The information on it must be digitized, not just a picture of the document, but the information must be extracted. So it always asks the question to us as we address our challenge of going on the path to digital hospitals: how is the data collected and what can be measured as a result. So I want to ask a very important second question. What is wrong with paper? Because I think the question should be, what is special about clinical documents? Because 99% of hospitals still use them as a method for collecting information. There must be something special about this if very intelligent people are still using them to collect information. In our daily lives, we use a lot less paper than we used to. I cannot remember the last time I wrote a letter. Okay? And I should write another one to my mother to say Happy Christmas. In healthcare, clinicians and staff are very protective about the design of their forms, even when they are translated onto a computer system. Now, healthcare professionals are very educated and motivated. They're motivated about giving good care and capturing information. So why do they not all use the computer systems? Now, this is why going to a digital environment is a journey. So we always ask ourselves, are we asking the right questions? I want to show you some examples of medical forms. What's so special about them? There must be something inside the medical form that makes them valuable. And if you are seeking to get to a digital healthcare environment, you need to take the value from the forms and ensure that it is reflected in the digital solution. Now, we have gone down this path, and I want to just tell you a little bit about our story. When you look at a form, this is what we felt about it. Within the form is the blueprint representing the knowledge of how to provide the care. Because somebody designed these forms in a way to manage and transfer knowledge about care. So there's intellectual property in the forms. So if a form could speak, what would it say? It would say that a forms committee designed every element of my design, my workflow and my use in order to make me simple, intelligent and relevant. Who gets training on how to fill out a form? It follows a logical sequence. And yet when you are asked to use a digital solution, you must do training for 2 weeks. So something is being lost. And remember, and it was a famous American physician whose name I have forgotten, who said that information is care. So it's important that when you go on a digital path, the information and the knowledge within the processes which are captured on the paper are reflected then in the digital solution. So I just want to summarize that point before I bring you on a bit of a journey and then we can all have coffee. The hospitals, the professionals' intellectual property has gone into the form. It has made it easy and fast. But frequently, when hospitals go on a journey of digitization, it doesn't become data that you can measure, it becomes a scanned page. So in order to go on a journey, you need to make sure that you retain the intelligent and you enable the measurement. So the summary points that I'd like to make is that very few hospitals, and it has been mentioned before, very few economies have a digital healthcare environment because there is challenges. There is the human behavior challenge. All of these forms were designed by medical people, and the point was made earlier on, medical informaticians must come from medical backgrounds, but frequently IT systems are designed by IT people. So you face the challenge of capturing data from systems where there's a mix of paper and technology. So how can we go from this solution to an EMR? There is a path, there's a journey that you can follow. So how can you go from an intelligent, simple and relevant form, which was designed for the user and incorporates the care blueprint, into something which is very important, which we all recognize, an electronic medical record, one version of the truth. But frequently that is a couple of computer systems. So a big factor is you need to innovate so you don't lose the value or the information and you get clinicians buy-in. you need to go on the journey. So I will give you a specific piece of evidence from Ireland where we developed an innovation to capture structured data by placing the structured data upon digital solutions. So I will show you what we did. First of all, and the point was made about interoperability, I could not agree more. The integration between systems, because in a hospital there's lots of systems. When we walk into our hospitals, there's a lab system, a pharmacy system, there's a human resources system, a finance system. There's lots of systems. But there's lots of ways of integrating the data between them, because you are not going to get, it is not sane to replace all those systems with just one. So they must talk to each other. And there are a lot of solution providers out there that we manage to get to talk to each other. So the first step is to make sure the data is integrated. The second step, and this is an example of a consent form used by one of our hospitals, is that we take the layout of the form and we actually use it on the input screen. So that immediately the clinician goes, that's my form. That's it, I will start to use it. All the time the information is being sent back to the other systems. In 6 months, the form should retire and they should use the other systems, because there is all the functionality there, they just never used it because it was not their form. You bring them on a journey into the technology. This is a very interesting example from a doctor who said he wanted his care pathway to be an input form. In the right-hand corner where it says general management, that generates orders. Now, he could achieve this result using 6 or 7 screens in the computer system, but he wanted to use his form because his intellectual property was in the document. And in order to bring him on a journey of using technology, you address the human factor. So we call it paper on glass. You put the paper on the glass. And let me assure you that we do not change how patients are admitted, treated. We know that there are bigger systems in the hospital, but we share their information, and that means on a tablet, on a computer on wheels, at a desktop, the clinicians and nurses are using views that they are familiar with. They may not use them in a year's time because the EMR should be more adopted, but you do not want to take one big step. You want to take small steps. And all the time, anything that is captured is sent back to the other systems, so there is an EMR, not just a collection of scanned documents. So the end result is that since 2010, when this was born, we have clients in the UK, Ireland, Australia, and now also in the UAE, who have seen the rapid adoption of the remainder of their documents, which were not in the EMR, are now in the EMR, but also if they are beginning the EMR journey, they can begin it by saying, hey, it's your form on top of the screen, your intellectual property, your care, your information. So, what was this presentation about? It was about measuring care. In order to measure care, you need information. Information is hard to get, even if you are a digital hospital, and there are very few digital hospitals. So what about the 99% of hospitals that aren't digital? So what we do is we take the intellectual property from the clinician, we have it as the first screen, overlaid on all of the integrated data so that they are in the system. And then, maybe 6-9 months later, we retire because they are now within the EMR. So I would like to thank you very much for your attention. We are hosting the World of Health IT Week with HIMSS in Ireland in May. And if you contact the Embassy of Ireland or our own organisation, I'm sure we, along with HIMSS, would be very pleased to see you there. And naturally, we will be at HIMSS Middle East, which is going to be a very exciting event later on this year. So, shukran, thank you, and I hope you come in.
So we came to the last paper on this session.